Hi, good morning everyone. I am Rahul Nanhal, COO at Cureka.com, and we are back with our weekly Instagram live session with a specialist doctor to take care of your concerns. Today we are going to talk about breastfeeding and infant nutrition, and a very specialist doctor is going to join us, Dr. Sujitha Natarajan. So at Cureka we come up with these specialist sessions with multiple doctors to help you take care of your day-to-day life and lead a healthy living. So Dr. Sujitha is going to join us in just a while. I think doctor is going to join us now in just a few seconds. Good morning, Dr. Sujitha. How are you?
Good morning, everyone. I'm fine. How are you?
Wonderful. Wonderful. Thank you. Thank you for coming to our weekly Instagram live session. The topic for today's discussion, doctor, is breastfeeding and infant nutrition. And we are going to cover some of the questions which we have received from our guests and listeners. And also, if guys, if you have any questions around infant nutrition or breastfeeding or maternity care for that matter, please do write it in the comments box below, and we will try to take them up during this session. Or even, in fact, after this session, when we post it on our Instagram and YouTube channels, you can write your comments there and we'll come back to you. So moving on, doctor, the first question that our listeners have is it true that formula-fed babies are not that smart? I mean, this is a very common question that people are having.
It's not actually true, but there is no scientific studies to prove that formula-fed babies are not smart. But breastfeeding has some advantages, such as because in breast milk contains these.
We've somehow lost your voice, doctor. We are not able to hear you. Now, okay, yeah. Hello?
Yeah, can you hear me?
Yeah, I can hear you now. Yeah, if you could please repeat what you just said, that would be great.
Breast milk contains DHA, which is docosahexaenic acid, and arachidonic acid, which is an essential amino acids, which is essential for brain growth and development. This is actually more in breast milk compared to this formula milk. This might be a fact. Breastfed babies are smarter, but there is nothing that only breastfed babies are smarter than the formula-fed babies. Other factors also corresponds to this, especially the genetics, as well as how the parents treat their baby and the environment, good environment also, and good nutritious food till 2 years of age is essential for brain growth and but breastfeeding babies gets more nutrition and antibodies compared to formula-fed babies.
Right. And a lot of moms and a lot of parents, they WhatsApp it to us as to which infant nutrition formula is good for them. There are, so many brands in the market. I mean, not going into specific brands, but let's say Nestle, Similac, Captamil, Dexolac. There are so many brands in the market. They just want to know how to find out what is the best product suitable for their kid. So how to find it out, doctor?
Compared to breast milk or formula milk is little digestive capacity, everything will be little difficult. But we have to, every baby has a different needs, because preterm baby needs more calories and more nutrients. So we have to get a preterm formula. And some baby has some cow milk protein allergy. In this case, and even breastfeeding intolerance also can happen in some babies. In this case, for soy formula instead of normal milk. And each formula milk should feed the whatever necessary calories, proteins, minerals requirements should be corresponding to that. The baby's formula milk can be different. So we have to see a pediatrician, and they will be providing your baby's formula milk according to their needs.
Right. Understood. So we have to see a pediatrician. They'll be the best person to guide you as to what is good for you. Completely makes sense, doctor. So, doctor, there is a question from one of the listeners. They say that she is a nursing mother and her baby is like 1 month old now. And what food should she give it to her kid, and what food should she avoid giving?
Yeah, nursing mother should avoid some foods because some foods can make the baby to get more gas and they can have colic, everything. And some foods can reduce the supply of the mother also. So especially the new nursing mothers, at least for first 6 months, they should try to avoid alcohol, even caffeine drinks. They have to take one or two cups of coffee. Try to avoid spicy food, processed milk products and everything. And try to include more of fruits and vegetables in your diet, and try to take fish, meat, and which can increases your supply, especially nuts, almonds can increase your milk supply, and flax seeds, fenugreek seeds, and hydrate more. These can improve your blood supply and blood supply as well as breast milk supply. This will be helpful for the feeding mothers at least for six months.
Right. Understood. And doctor, like, a lot of moms ask us a question that, can I give a baby feeding bottle to my newborn while she's breastfeeding?
But I'll suggest only to give breastfeeding, but many working moms have difficulty in breastfeeding their baby during a day, and they can prefer breastfeeding during night and bottle feeding. But I prefer them to give at least for 2 to 3 months give exclusive breastfeeding, because that latching issues can happen and baby takes a bottle feed more frequently than breastfeeds. They try to avoid breast milk. And moreover, only the baby sucks the breast, the mother will secrete more breast milk. So in case working mom and mother, you can give a formula, can give either a formula feed, or you can express your own milk and keep it in a normal temperature. It can be kept it for 4 hours in a normal temperature. If you are refrigerated, you can use it for another 1 to 2 days also. So that in that cases alone, you go for formula feeds or any bottle feeds during daytime and try to give a breastfeed at least in the night also. But in case if you are not a working woman, try to give as much as possible of your breast milk, because breast milk contains more nutrients and it will be easily digestible for baby, as well as it will also helpful for you to secrete more milk also.
Right. Now, a lot of moms, they have a question that their newborn to whom they are breastfeeding is not gaining weight. What they can do about it?
Initially, even a normal breastfed babies, initially during first 2 weeks of life, they tend to lose their birth weight and then only start to gain weight. So it is not a problem. In some condition, the baby is not latching properly. The mother is not giving properly the milk. Because the position is also more important. The baby has to latch properly. Mother should be position the baby properly, and baby's mouth should be fully open, and the baby mother's breast tissue should be fully over the baby's and then they should be giving feed every 2 to 3 hours once. Even during night time, they should feed the baby every 2 to 3 hours. Even if the baby is sleepy, you have to wake the baby and give. It might be that your baby is not gaining your breast milk, you're getting enough breast milk, and you have to check whether you're getting enough breast milk also. This might be one reason that the baby is not gaining weight even after giving breast milk.
Right. And a lot of new moms have a question that, they'll be losing some weight themselves during breastfeeding while they're breastfeeding. Does it cause weight loss in mothers when they're breastfeeding to their newborns?
Yeah, breastfeeding is actually breastfeeding consumes some calories. So newborn mothers have to take additional 500 calories daily compared to other mothers. And it is actually useful only because pregnant women would have gained around 8 to 16 kgs during their pregnancy. But this breastfeeding helps them to lose their weight during this first 6 months also. And this breastfeeding not only lose their weight and to bring back their weight previous before pregnancy, it also helps them to prevent stress they are able to prevent the diabetes, hypertension, and even there is have proven studies that there is a less chance of breast cancer and ovarian cancer in the mother who's breastfeeding compared to the mothers who's not breastfeeding. So if you are losing weight during breastfeeding, it's actually normal. You need not worry about that. But you should consume extra 500 calories, and you have to consume what are foods that can improve your breast milk. You can take that, and you can take a nutritious diet, hydrate yourself, and you should not worry about your weight loss during this first 6 months of your breastfeeding.
Right, right. And a lot of parents want to know what nutrients does their kid get from breastfeeding.
Actually, breast milk contains so much nutrients, whatever the baby needs. Actually, the 100 ml of your breast milk contains around 67 kilocalories and 1.1 grams of proteins. It contains all the amino acids, especially I told you the DHA and arachidonic acid, which is essential for the brain development and nervous system, is more in breast milk. As well as breast milk contains antibodies, which protects your kids during the first 6 months from infection. There has been some proven studies that breastfed babies have less chance of getting diarrhea, pneumonia, and other infections compared to formula-fed babies. And breastfed babies have digestibility, and the feeding is also good, and there is a good gross motor function. Everything is good compared to the formula-fed babies. So, in case if you are getting a good breast milk, try to breastfeed the baby.
Right, right. Wonderful. I mean, there is no substitute for breast milk, is what you're saying. That is the best source of nutrients for the newborn, right? By far. I mean, this is what we know as per medical evidence. Now, coming back to Cureka, guys, we have got a free of cost WhatsApp platform which you can use to ask your queries about any new mom problems, or you have any questions around how to feed and keep your newborn baby fit. We've got a lot of experts sitting in the panel who can easily guide you on your questions. And there are a number of products, top brands across India and globe available on Cureka, which can choose what is best suitable for your baby. Whether it is with respect to their daily care, their feeding bottles, or their nutrition, infant formula milks. We've got one of the best brands in the world available right under our portal. So you can look into Cureka.com. We have also got a store in Indiranagar, Bangalore, which you can visit. If you are there in Bangalore, do give it a visit and let us know how do you feel. And you can visit our Cureka.com portal as well. So moving back now. Moving on, we have got next question coming in from a guest, that how does a parent know that while breastfeeding that the baby is now full?
Baby is not full or full?
Full. I mean, the baby is feeling full now. Baby has got sufficient milk.
When the baby gets sufficient milk from the breast, the baby tries to move away from the breast, and the baby starts crying after feeding. And the baby might slow out their sucking also, and the baby try to be and everything. Sometimes the baby might sleep during feeding. This indicates that the baby is full, and the baby might have some burping. Sometimes some wet burping can happen. This indicates that your baby is full, and you should try not overfeed. That's what I tell every 3 hours once you have to feed the baby, and don't overfeed also, because if overfeeding can lead to reflux disease, everything, and the baby might lose weight also. Even overfeeding can lead to weight loss also. Right,
right. So doctor, already a lot of guests are commenting on this particular video. There is Mr. Archika, who is mentioned just now that that's a mind-blowing explanation by you. They're appreciating a lot, and the information that you're providing. Yeah. So now there is another question from a listener which says that can she formula feed during the daytime and breastfeed at night?
This is already I told you. In case if you are a working mother, you can express your breast, keep it, and you can store it, and you can either give it in a bottle or a palada. You can feed at daytime. And night time, try to breastfeed by yourself, because I already told, if the baby sucks, you'll secrete more milk also, and the bonding between you and the baby will also improve. So you can also, but this is some circumstances of working mothers, but you can do the formula feeding
Yeah.
try to give breastfeeding. First 2 to 3 months, you try to give exclusive breastfeeding.
Yeah. Understood. Doctor, I believe a lot of moms, especially who are working moms these days, or moms who are even at home working in bigger families, they have a lot of course also. They have to do a lot of activities also. So what happens is that they get a lot of physical pain also while breastfeeding. It's not a very comfortable posture. What they can do to relax themselves and feel better, because that's a very tiring process to feed your
But
baby.
they have to hydrate themselves and eat
Yeah.
nutritious. Sometimes some mothers have some flat nipple. In such cases, even if the baby sucks, the milk won't come.
Yeah.
And if it is not
Yeah.
coming, mother can get that breast pain or engorgement. In such cases, you can do a syringing and use a breast pump, remove the breast milk, and you can give that breast milk through a palade or tube. And mothers can have some breast infection also. You have to treat it during that time alone. Try to express your milk instead of giving direct breastfeed. So that's what I'm telling. Every time you have to empty your breast. If you are not emptying your breast regularly, some breast milk can be lead to infection, and you can feel that breast pain. And you can massage with the hot water your breast every 2 to 3 hours while expressing your milk also. This might
Right. Right.
be useful for some working moms also.
Yeah, of course, that's very useful. We would also like to know from behalf of the moms, that are there any exercises for them that they can relax themselves after breastfeeding their kid? They feel tired. Maybe some exercises that can relax them, make them feel better.
Even they actually burping the baby is an exercise for both the mother and baby.
Oh,
You can
wonderful.
and you can take the baby along with and walk for some steps also with the baby.
Mm.
It will create more
Mm.
new one also, and
Mm.
it make you be happy and avoid stress and hydrate yourself. This might be good and useful for you.
Sure, sure, sure. So we have got a question coming in from a listener, Miss Shankara, who asked that I breastfeed my baby, who is 4 months old. She's spitting up. Currently, we give neopeptide vitamin 3 drops. What should I do to avoid spit ups?
Preterm babies will be spitting up more frequently than term babies because their digestive system is mature. That's what I say. After feeding, feeding from each breast, you just burp it for 5 to 10 minutes because this prevents the spitting up. And spitting up small amount of milk, which is white in color, you need not worry. If the baby is spitting up every milk you give and the color of the milk is little yellow or green in color, and the baby is losing weight, then you have to see a pediatrician. Otherwise, you need not worry about that spit up because every time after each feed, you try to burp up the child. This will be reduced gradually, and you need not worry about this.
Right, right. Uh, Thank you, doctor, for sharing that. I am sure that's going to be very helpful for them. Now, another question is coming in from a listener who is asking that, ma'am, for a preterm baby, when can a mother start breastfeeding? Do you recommend or preterm formula milk is better to catch up the weight?
Till 34 weeks, the baby can't directly breastfeed the baby. If the preterm babies, if the baby is less than 34 weeks, we can express the mother milk and we can give it through either a palade or a tube feeding can be given till 34 weeks. After 34 weeks, we can make the preterm baby to give direct breastfeed also. There is no concern regarding giving a direct. In case if the mother is not getting enough milk, then we can go for a preterm formula. But otherwise, whatever mother is having a direct breastfeed is better than giving a preterm formula. But in case the baby is not getting enough breast milk, then you can go for preterm formula. Fortifiers, which is we call it as human milk fortifiers, can be given along with the mother milk, especially for preterm babies, to meet their requirement calories and.
Okay. Yeah. Yeah, doctor. We can hear you now. I think there was a slight internet issue at your end. I mean, now we are back. Yeah. So, doctor, there is another question from one of the listeners who says, "Hi, ma'am. From day one, my baby is passing poo whenever my wife breastfed." Just a second. Doctor says it's normal, nothing to worry. He is gaining weight and milestones are good. 3 months now. Do I need to worry?
Yeah, you need not worry. Unless you are giving only breast milk, you need not worry about the baby passing stools after each stools, because their bowel movement has not developed maturely. So they every time they can pass stools, and it can be like a loose stools also. You need not worry. But in case if you see any blood in stools and the baby is little cranky after each times, baby is not weight properly, baby has some feeding difficulties, then you can worry about this. Otherwise, even if your baby is passing like 8 to 12 times loose stools every day, it's normal. You need not worry till 6 months of age, unless you need not worry about that.
Right, understood. So, doctor, moving on to the next question. So, how long should a baby breastfed breastfed every time? How long does it take, or what should be the ideal duration?
During first 2 to 3 months, you have to breastfeed the baby every 2 to 3 hours once. Even during the night time, you have to feed the baby. You have to like one breast you have to feed like for 10 to 15 minutes. Then fully, completely given one breast, you can switch to the other breast for 10 to 15 minutes. This is during first 3 months. Next 3 to 6 months, the baby might have, you can take some gap like 3 to 4 hours once you can feed the baby. And the baby can feed much faster compared to first 3 months. So the baby can feed it by 5 to 10 minutes itself. The baby can feed one breast and can go to another breast. But this is based on how much the baby needs. But during first 3 months, even if the baby is sleeping, you try to awake the baby every 2 hours once, feed the baby. Then only the baby will gain the weight.
So moving on, correlated question to this is a lot of listeners are asking, and a lot of parents, new parents have this question: is that what if the baby refuses to be breastfed? They're not taking mother's milk.
Yeah, sometimes the baby might refuse breastfeeding. You have to see for any infection in the baby. You have to see for any mouth ulcers or anything in the mouth. You see infection is there in the mouth. In case if there is an infection, you have to see a pediatrician, and you can use if the baby has some nasal obstructions, baby nose block is there, then the baby has some issues while feeding. In such cases, you can get a nasal drops and can relieve the nasal block also. And sometimes if mother is getting the baby might has no interest to get suck the baby mother's breast also. This might be one reason also. So in such cases, a proper latching also should be there. If you are not latching properly, then the baby might have no interest in feeding also. This might be some reasons that the baby might refusing breastfeeding.
Right, right. I'm sure that is a lot of help to the new moms who have a lot of questions around this. Now, moving on to the next question, doctor. What should I do if? Okay, sorry. So, does burping mean that the baby is full? If the baby starts burping, does that mean that the baby is full?
Yeah, mostly even after baby feeds, we have to burp it. If the baby is burping, then the baby is full. You have sometimes the baby might have some burp, spit out some. If the baby is full, so in this country you should not overfeed the baby because overfeeding can already I told it can lead to reflex diseases also, and aspiration can happen in the baby also. So in such cases, you have to give us some signs that the baby is full or not. If your baby is not interested in taking feed, the baby is full now, the baby will be active and happily removed from the breast. These are some indications that the baby is full. If the baby is burping, overfeed the baby. Stop the feeding at the time.
Right. Great. So, what signs should a new mom or new parents look for that could indicate gas or colic?
Actually, colic is nothing but what the baby swallows some air while feeding also. This can lead to some abdominal pain in the baby, some discomfort in the baby. The baby will be having some intense crying will be there. It will be an inconsolable cry. Even after cuddling everything, the baby will continue to cry and the baby's face might turn red also. And the baby clenches their fist. Their tummy will be blocked. And every time the baby cries, the baby might pass some gas also. This is some of the signs of colic.
Right, right. Now, doctor, what are some of the home remedies, that new parent can have to soothe the baby's gas and colic?
That's what every time after feeding, you try to burp the child for 10 minutes or 5 minutes unless the child burps. This will be holding the child in the upright position like this can give some relief to the baby. And you can use some pacifiers and warm compressors can be used to relieve the colic pain. And now many gas containing drops, especially silicone drops, can be pulled to relieve this colic pain. And grape water should not be given because it has no proven benefits also. And the mother's diet should also be changed because mothers take spicy foods containing garlic and processed foods, even cabbage, broccoli. This can induce gas in the baby. So mother should try to avoid such foods if the baby has some cold. The mother can eliminate this eliminate these foods from their diet.
Right. So the next question that new parents have is that should I feed my baby every time he or she cries?
Every time the baby cries, it doesn't indicate that the baby is hungry because the baby is crying. It is the last stage of hungry. Before itself, we have to feed the baby. But the baby might cry because of some other issues also. You have to check for any wet diapers and you can see for any ear infections or any nasal obstruction. Even colic pain can be inducing crying while breastfeeding, and even can cause pain in the baby. So the baby might be crying. So it doesn't indicate that you have to feed the baby every time the baby is crying. You have to look why the baby is crying. If the baby has hunger issues, then you can feed the baby. But you have to look for other signs why the baby is crying. Then only you can feed the baby.
Sure, sure. And are there any special feeding techniques that can help reduce the risk of choking in newborn?
Yeah, there is so much techniques to reduce choking. Already I told after every time you feed the baby, you burp the baby. This will be reducing the incidents also. And you have to feed the baby in upright position. Like if you feed like it can reduce the risk of choking. In case if you are getting a over milk supply, your milk is more, then the baby might have the risk of choking. In that cases, the mother can use a laid back position, such as the mother can keep a pillow and can lay it down like this and then feed the baby so that the milk won't be overflow. Because overflow milk can also causes the risk of choking also. So every time you feed the baby, you support the baby so that the baby has a less risk of choking, and avoid lying down and drinking the milk, because while lying down there is a high risk of choking and there is a high risk that the baby's milk can go into their ear and can cause an ear infection also.
Right. So doctor, moving on to the last question of the day. So how can new parents understand or identify if their baby is not gaining enough weight?
Unless your baby is passing like 8 to 12 times urine per day and 6 to 8 times stools per day, baby is active and baby has gaining weight adequately, you need not worry. During initial first 2 weeks, I told there will be a loss of weight. The baby will be gaining their birth weight after 2 weeks. Like after 7 to 10 days only, the baby will start to gain their birth weight. And then they have to gain like around 30 grams per day they should gain. During like first 1 month, the baby must gain around 600 to 900 grams of weight. So you need not worry about this. Unless your baby is gaining weight properly, you can feed through breast milk alone.
Right, right. Thank you so much, doctor. I think this has been of immense help to a lot of new parents. There are time and again, I mean, we have been having a lot of questions from people asking about how to feed the baby, what kind of infant milk is available to them. Guys, again, if you have got any question around your infant's diet or nutrition or how to take care of your baby, feel free to ask. We have got a WhatsApp platform free of cost for you, and our expert doctors will reply to you within a few hours of your questions. Thank you so much for your love and for your affection that you have shown to us. We have grown multiple times in the past. Couple of months itself, I mean, growing from, strength to strength every single time, you come back to us and shower your love. And thank you so much, doctor, for joining us today. Wish you a very happy weekend, and we do look forward to having you again on our show.
Thank you.
Thanks a lot. Take care.